right, thank you for joining me again. So in our previous video, we talked about the cortisol inducers, which are going to be our 5 senses. We talked about how to utilize these 5 senses so that when it's time for you to start waking up, you want to be able to use those inducers to get you awake. Similar to how if we had no other input outside of our sun cycle, when the sun starts to go up, it would induce cortisol using our sense of sight. Now, the other important piece, which we talked about in the previous video, is the opposite. We want to suppress these senses and try to keep them at a low level, at a calm level throughout the night in order to allow melatonin to go up overnight. Now, in this process of keeping this low, let's look at some basic examples of why we would get what we'd consider a cortisol spike at nighttime. One example is anything that's going to cause these 5 senses to be activated, quote unquote, a threat to your survival. So an example would be something like smell. What if you suddenly, while you're sleeping, started to smell smoke in the house? And if that happens, you want that cortisol spike to happen. You want your body to go into activated productivity mode so you can get yourself out of that situation. Another example would be something like a very, very loud sound. If you suddenly had a super loud sound, again, you'd expect that cortisol spike would go up. But in another situation, I want to talk a little bit about what we would consider other stressors. And these would be internal stressors to the body. So one internal stressor to the body is something like blood pressure. If you have a diagnosis of high blood pressure, or in general, when you're going to sleep at night, we really want our pressure to be at a low normal state. And this is so that the body can function at its maximum level. And if that blood pressure significantly rises throughout the night, it is really going to inhibit us from getting quality sleep. So that is an example of an internal stressor that we want to avoid, whether it be by using medication management, taking the appropriate medications at nighttime or during the daytime, working on things like mental stress management. But another example is fluids. So there are exceptions to this example, but taking something like excess fluids at nighttime, drinking too much fluid before you go to sleep, can actually be detrimental and can actually contribute to have you wake up in the middle of the night to go to the bathroom. And that itself, just causing the muscles to tone up and get you to go to the bathroom and come back, can activate some little bit of cortisol. So to avoid that, being mindful the amount of fluids you take in at night, the amount of food you take in at night can be extremely valuable. And in a future video, when we talk about things like intermittent fasting, understanding the role of fasting state before you go to sleep can make a lot of sense as to why and how that contributes to the quality of your sleep. Another example of stress is anything related to the airway. So in your airway, you need to be taking good, solid, deep breaths in order for your body to stay in this very nice, what we call parasympathetic state, to keep you asleep, keep you away from threat state, and keep you in rejuvenation mode. So anything that inhibits your airway is then going to come in the way of the body's intention. So what are examples of things that come in the airway? The biggest example is anything that's going to block the lungs and the trachea from getting that air. One example of that is obstructive sleep apnea. So if your doctor or if you have ever noticed that you have significant snoring at nighttime, or anybody has even observed you choking and not being able to breathe over the course of the night, see if you can get tested, because if you have sleep apnea, you're not getting that air that is necessary for you to maintain those deep breaths throughout the night, which means you're likely getting these cortisol spikes throughout the night and not getting that restorative, rejuvenative sleep. In that situation, we use something like a CPAP, which keeps that pressure and keeps that trachea nice and open, allowing you to get in those deep breaths throughout the night and allowing you to get that restorative function back. Another example is anything that's going to block this passageway, the nasal cavity or the oral cavity. So things like dry mouth throughout the night, or things like sinus congestion and severe allergies. You really, really want to try to find something that will help you control your sinus symptoms or your allergy symptoms, especially at nighttime. Things like nasal rinses or neti pot use, things like clearing your sinuses and making sure you're blowing your nose throughout the day. Basic things that will help you clear this passage so that you're able to get the air in and take those deep breaths that keep you in that restful state. So I hope this video helped to explain the concept of stress, because we can experience external stress that would cause cortisol to go up, similar to, like we said, smell or sound, or we could be experiencing internal stressors related to our cardiovascular system or respiratory system that might be impacting the quality of your sleep. Thank you, and in the next video, we're going to now look at the other boss, which is melatonin. Talk to you soon.